Summer in the Philippines is a time of joy, filled with long days of sunshine, trips to the beach, and quality time with family and friends. However, summer also brings a heightened risk of dog bites. As temperatures rise, so does the incidence of dog bites. Understanding the factors that contribute to this risk is crucial. By being aware and prepared, we can enjoy the season to the fullest. Let's make this summer memorable for all the right reasons. The connection between rising temperatures and increased dog bite incidence is not merely coincidental. Studies have shown a clear correlation between heat and canine aggression. As temperatures climb, dogs experience physiological changes that can affect their behavior. Heat can cause discomfort and irritability in dogs, making them more prone to aggressive outbursts. The inability to effectively regulate their body temperature can lead to stress and anxiety, which may manifest as increased aggression. Furthermore, the warmer weather encourages more outdoor activities for both humans and their pets. This increased interaction can lead to more opportunities for misunderstandings and potential conflicts between dogs and people. Recognizing the signs of heat stress in dogs, such as excessive panting, drooling, and restlessness, can help us avoid potentially dangerous interactions. The statistics surrounding dog bites and rabies in the Philippines paint a concerning picture. Hundreds of thousands of dog bites are reported annually, especially in summer. The WHO identifies the Philippines as high risk for rabies, a deadly disease from animal bites. Most human rabies cases come from dog bites, stressing the need for vaccination. Understanding dog bites and rabies is crucial for promoting responsible behavior. By acknowledging the issue, we can create a safer environment. Rabies is a viral disease that affects the central nervous system and, if left untreated, is almost always fatal. The virus is primarily transmitted through the saliva of infected animals, most commonly through bites. While dogs are the primary source of rabies transmission in the Philippines, other animals such as cats, bats, and monkeys can also carry the virus. Any bite from a potentially rabid animal should be taken seriously and requires immediate medical attention. Even seemingly minor scratches or licks on broken skin can transmit the virus. The incubation period for rabies can vary from weeks to months, making it challenging to diagnose immediately. Prompt post-exposure prophylaxis, or PP, is crucial following a potential rabies exposure to prevent the development of the disease. By working together, we can significantly reduce the risk of rabies transmission and protect our communities from this deadly disease. Section 5. First aid after a dog bite. Quick action saves lives. Following a dog bite, immediate action is crucial to minimize the risk of infection and potential rabies transmission. The first step is to thoroughly wash the wound with soap and water for at least 15 minutes. Next, apply a topical antiseptic solution like povidone iodine to further disinfect the area. Cover the wound with a clean bandage to prevent further contamination. Seek medical attention as soon as possible, even if the bite seems minor. A healthcare professional will assess the wound and determine the appropriate course of treatment, which may include rabies post-exposure prophylaxis, or PEP. Early medical intervention is crucial for preventing serious complications. Prompt and appropriate first aid can significantly reduce the risk of infection and potentially life-threatening diseases like rabies. Section 6. Be aware, be prepared. The BioLis campaign for rabies prevention. The Department of Health launched the BioLis campaign to combat rabies in the Philippines. BioLis stands for Bilis, Lunas, at Información sa Rabies, which translates to speed, cure, and information on rabies. This campaign emphasizes the importance of prompt action after a potential rabies exposure. It promotes responsible pet ownership, including regular vaccination of dogs and cats. The campaign also emphasizes the importance of seeking immediate medical attention after a potential rabies exposure to receive prompt post-exposure prophylaxis, or PEP. The campaign's focus on speed highlights the critical nature of timely intervention after a potential rabies exposure. By promoting awareness, responsible pet ownership, and prompt medical care, the campaign aims to protect communities from this deadly disease. Section 7. Recognizing rabies symptoms. Early detection is key. While prompt post-exposure prophylaxis, or PEP, is highly effective in preventing rabies, recognizing the symptoms of the disease is still crucial. Early detection can be life-saving, especially in cases where PEP is delayed or unavailable. The initial symptoms of rabies can be flu-like, including fever, headache, and muscle aches. As the disease progresses, more specific neurological symptoms may appear, such as confusion, agitation, hallucinations, and difficulty swallowing. Any unexplained neurological symptoms following a potential rabies exposure should be immediately evaluated by a medical professional. The progression of rabies can be rapid, and once symptoms appear, the disease is almost always fatal. Early intervention is crucial for maximizing the chances of survival. Section 8. Expert advice. Preventing dog bites and rabies. Experts emphasize the importance of vaccination for both pets and humans. Vaccinating dogs and cats against rabies is the most effective way to prevent the spread of the disease. Similarly, pre-exposure prophylaxis, or PrEP, is available for individuals at high risk of rabies exposure, such as veterinarians and animal handlers. Responsible pet ownership includes keeping pets confined, supervising their interactions with others, and preventing them from roaming freely. Proper training and socialization can also help reduce the risk of aggressive behavior in dogs. Educating children about how to interact safely with animals is another crucial aspect of prevention. By heeding the advice of experts and implementing preventative measures, we can create a safer environment for ourselves and our communities.